Sea of red across the board for biotech, pharma, and the broader healthcare sector. The moves follow last night's announcement that Donald Trump has tapped Robert F. Kennedy Jr. to lead the Department of Health and Human Services. And now two siblings who advised Kennedy are coming into the spotlight. Casey and Calley Means are chronic disease entrepreneurs known for questioning traditional medicine. They have medical expertise, and they could play a key role in the next administration's health policy. Stat News' Isabella Cueto has been reporting on the Means sibling rise to prominence. She joins us now. Isabella, great to have you with us.
Thanks for having me.
Could we see one of the Meanses, the heading CDC or FDA or any of the other sort of agencies within HHS?
Well, there have been reports that Casey Means may be on the list of considerations for the FDA.
And so what is their connection to RFK Jr., and do they share a lot of the same ideology? Some of it? How much overlap is there?
I think there's quite a bit of overlap. I mean, these are really kind of RFK proteges. They have a disdain for corporate influence and regulation, like big food and big pharma, and think that there's a big conspiracy to keep Americans sick, and they want to address that.
What do you think is the biggest, you guys over at Stat have been talking to a lot of professionals, a lot of, analysts, et cetera. What is the biggest concern about this ideology and what it could mean in terms of Medicare when it comes to drug approval? I mean, what is the one thing that sticks out?
I think it's really the question of RFK. If he gets confirmed to be the Secretary of Health and Human Services, he would have broad oversight and could get in the way of drug approvals and make higher walls for pharmaceutical companies to jump over to get their drugs approved.
In terms of the Means, what have they done so far in the pursuit of this ideology? Some of their thoughts sort of align more to the left, actually, removing ultra-processed food from SNAP programs, things like that. So where do they fit in?
I think that's really what they've been most successful at, is getting these talking points and ideas that are traditionally left and then adding in a dose of outrage and making them MAHA, Make America Healthy Again, and aligned with MAGA. And so they've been on some of the biggest podcasts, Joe Rogan, Tucker Carlson, and really created this groundswell of support for the ideology, which was a big boon to the whole movement and to RFK specifically.
Let's say the Meanses somehow work their way into heading an agency and RFK as the head of HHS. Isabella, I'm just curious, how quickly can the wheels turn in terms of actually putting some of that ideology to work?
I think we don't know. I mean, I think it depends the people that they choose to surround themselves with and staff the agency with. I think if they decide to make staffing cuts, that could kind of gum up the wheels on some of the usual work that these agencies and departments do. But, we're expected to get more indications soon.